During that pandemic, we were motivated to build up and starting operation of Bilao because everything was closing. It's also a good business strategy that if everything closes up, you open. Why? Because if you're the only one open around the area, customers will still come. Plus, we were frontliners. So we want to share to other fellow frontliners, at least just to give them a little hope.
In the midst of a pandemic that closed more than 1,000 restaurants in New York City, 3 Filipino nurses decided to open a restaurant to feed their community while they worked to save lives. Joanne Calanog, Jude Canella, and Mary Krista Noppel opened their Filipino restaurant, Bilao, in August 2020 while they worked overnight shifts at Mount Sinai Hospital caring for COVID patients. The partners named their restaurant Bilao after a woven tray that is used to clean and dry rice in the Philippines.
All 3 of us work in a Mount Sinai hospital. Usually right after work, we crave for Filipino food, and it's always in the morning that we want heavy meals. But unfortunately, it usually takes about 30 minutes to 40 minutes commute to go to a Filipino restaurant. And it was just a joke, it was a random joke that, oh, maybe we can buy our own restaurant or get our own restaurant in the future. Then it happened.
At first, we don't know if the new cuisine, especially Filipino around this neighborhood, will be getting so much support, which actually we did. The demand was so high. All of us were working full-time at the Mount Sinai Hospital. So pretty much getting off from work, we have to go straight here.
The owners hired 5 employees when they opened the restaurant. They now have 15.
It was a tough night last night. One of my patients had to, not a code, but we had to call a rapid response team. But I got my patient stabilized.
I think the hardest part during the pandemic was, since it's new, like nobody really knows, like the treatment and all that. Like I have patients from the start of the shift, they were, walkie-talkie, they're okay, no symptoms. But the following day when I come back, they're gone.
When we get off from our shift, we have to follow our safety protocols before going anywhere. Take a shower, we change our clothes, and sanitize ourselves.
None of the partners had any previous restaurant experience, and they used their savings to get the business started. The 3 partners remain the only investors.
Each of us put out like 30,000. We tried asking for some funds, especially for the government, but we got declined for that. We were not eligible to get a fund because we were just opening. So just for opening the restaurant, it was just out of pocket. We have to do a little bit of renovation. Thank God, luckily, the previous tenant was a bakery and then left a bunch of stuff. So we just have to buy a few stuff, and we got lucky because the interior of the restaurant is pretty much like this. So the total cost of the starting operation is from 80,000 to 100,000.
We have a 10-year lease here. So basically, the owner was asking for $9,000, but we were able to negotiate it. But at the end of the lease, it will be $9,000.
The New York metropolitan area has the 3rd largest Filipino population in America, and as many as a quarter of the Filipino adults in the New York, New Jersey area are health workers. So it's not surprising that the owners estimate half their customers are Filipino healthcare workers.
When we found this place, we found out that we have 4 hospitals. We have Lenox, we have Cornell, we have Sloan, and we have HSS. So we got a little hope that, maybe that can be our target market. That can be our customers, that can be our client. And it happened.
As COVID-19 cases rose in the winter, New York City prohibited indoor dining once again, so Bilao turned its focus to delivery, selling through its website and delivery apps and paying the associated fees. During winter, their revenue was mostly coming from online deliveries.
After the holidays, that's our slowest sales. Especially the indoor dining was closed, it was restricted. We only have the outdoor dining, but there was multiple days that we had a snowstorm in New York. So our online deliveries actually picked up probably 50%.
Additional cost that we had because of COVID is the outdoor dining. We have to make the barricade, the masks and gloves, the hand sanitizer, the thermometers.
Bilao has been open less than a year, and the partners are confident about their restaurant's future, especially as restrictions continue to lift around the city. Restaurants were able to reopen indoor dining at full capacity starting May 19th. They say they spend about 30% of their sale revenue on overhead expenses like rent, payroll, and utilities, and 35% on cost of goods, or what goes into making the food. Additionally, they say they've already received their return on investment.
The future of Bilao for us is expansion. We can go to the west side because there's no Filipino restaurant there, or on the upper west side because there's no Filipino restaurant there either. And in order for Bilao to be operational, open communication is the key. We try to balance each other's schedule, and we ask each other which one of us is flexible on a specific day that they can work here in Bilao.
All three owners say that even if they open new locations, they will never quit their jobs as nurses.
For me, it's my job, it's my passion, so I don't see myself quitting as a job as a nurse. Actually, I'm wearing the uniform of Mount Sinai now because basically I'm going straight to work after this interview.